Hello, my name is Emma Vreeken. I work for Universal Diagnostic Testing as a patient care coordinator. UDT is both a sleep lab and also a CPAP therapy clinic. Today I'm meeting with Troy Hunter. Troy is a family nurse practitioner who specializes in sleep therapy. Troy, I know a lot of our new patients are already on CPAP. Some of them have been using it for several years. What can they expect when they come and meet with you for the first time?
Well, Emma, that first visit is very important, and my goal is to understand the patient's past history as well as their current condition. Topics such as sleep apnea and what it means to the patient, conditions that can contribute to or cause sleep apnea or vice versa, and things that patients can do to improve their sleep apnea will be discussed. It is helpful for the patient to bring in their CPAP machine, even if they're not using it, for us to see on which settings the patients are currently set up. Also, since medications can sometimes contribute to or cause sleep apnea, a current medication list is also needed. Overall, that first visit lasts for about 30 minutes.
So Troy, what are some of the things that patients can do to control or improve their sleep apnea?
Well, one of the most common things we run into in our patient population is obesity. Many patients have actually tried to lose weight over the years, some more casually than others, with limited success. The research shows that patients, if they lost 10% of their body weight, could measurably improve their sleep apnea. One of the exciting things that we offer through Universal Diagnostic Testing is a program with our dietitian and personal fitness trainer who can evaluate the patient, create meal plans, and set up exercise regimen for the patient to follow. Again, our goal is not only weight improvement, but also sleep apnea improvement.
Are you able to write prescriptions for things like sleep tests and masks?
Absolutely. As a nurse practitioner, I can provide this type of prescription. Of course, as with all prescriptions, I need to understand the patient's condition and their history. Thus, it's important for them to see me first. Of course, if the patient already has a prescription from another provider, they do not need to see me.
Great. So do patients need to make an appointment to see you?
Well, of course, I have my regular business hours, and I recommend patients to make an appointment if they need to see me. However, I'm more than happy to accommodate any patient who just drops by if I'm available.
Great. I know that a lot of the patients that I've talked to are worried because they don't use their CPAP very often, or they've just stopped using it altogether. So can you talk to me a little bit about how you handle those patients in those certain situations?
Certainly. And we run into this type of patient quite often, where they've been previously diagnosed, have been using their CPAP therapy, but have quit their therapy for one reason or another.
Troy, I know a lot of the patients that I've spoken with are concerned because they don't use their CPAP very often, or they've just stopped using it altogether. So can you talk to me a little bit about how you handle those patients in those certain situations?
Of course. We've run into many patients who have previously been diagnosed with sleep apnea, but for one reason or another have stopped their therapy. Sometimes it's an easy solution, such as changing their mask, or getting a new machine which would be easier for the patient to breathe against. With some patients, however, we have had to use a gradual baby step-like approach, where we even go as far as having them start using their CPAP during the day while they are awake in order to get them acclimated to their therapy, and gradually graduate to the point where they are using that in their sleep. Of course, with all patients, the goal of sleep apnea therapy is for them to use their CPAP machine during any time that they're asleep.
Great. I know some of our patients need to have a letter from their doctor for their CDL driving privileges. So is this something that you're able to do?
Yes, I can. However, I will need to see the patient first. We can provide the information required by many of those forms, including measuring sleepiness during the day, downloading compliance information from the patient's CPAP machine, and other information that they require for those forms.
Great. Well, Troy, thank you so much for visiting with us today. It's been a real pleasure. As you can see, we are able to treat anybody who is currently using CPAP therapy or should be using CPAP therapy. If you'd like to call and make an appointment, or even if you just have a question for us, please feel free to call us at 801-938-4669. 5362, or you can call our toll-free number, which is 888-503-0038. Also, please take a moment to review all the helpful information that we have ready for you on our website, which is at www.sleeptherapyutah.com.